Welcome back. In the past, cancer has typically been associated with older people, but right now we're seeing more young people get cancer than ever before. It's kind of scary. Our 9 News health expert, Dr. Payal Kohli, joins us this morning to talk about this. Thanks for coming in.
Yes, good morning, Corey.
So talk about the numbers and what types of cancer we're talking about here.
You know, it's ridiculous. We're actually calling it an early onset cancer epidemic because we're seeing this not just in the United States, but across the globe, that young people under the age of 50 are now getting diagnosed with more and more cancers, more and more advanced stage cancers, and we're really looking at cancers across the board in terms of the types of cancers. So digestive cancers are very common. So for example, stomach, liver, pancreas, colorectal. We're also seeing head and neck cancer, which has been associated with HPV virus, which is becoming increasingly common. More breast cancer, more thyroid cancer, but even cancers like prostate cancer in young people.
Wow. Why is this happening? Why the increase?
Yeah, we're scratching our heads a little bit because this increase has been 30% since the 1970s. And like I said, it's across the board of the type of cancer. So part of it is that we're just better at detection. So we're screening and diagnosing a little bit more aggressively. But I actually think the bigger part of this is that there is some exposure that is happening to these young people, which we're not quite wrapping our heads around. That's occurring early in their life, because we do know that with exposures, especially cancer-causing exposure, sometimes it takes many, many years to manifest itself. So there's research that suggests that it might even be an in utero exposure when you're still developing, because we know, for example, that obese mothers have kids that are more likely to have colorectal cancer. Could it be an environmental exposure such as pollutants or radiation that's occurring across the board, around the globe? Or could it be something with our lifestyle, obesity, more sedentary behaviors, more alcohol use, more sexual partners, something like that that could be leading to cancers?
Something that we're putting in our body, something that we're eating.
Or something that we're doing.
Wow.
Yeah.
What are some of the medical implications of early onset cancer?
Well, you can imagine. I mean, having a cancer before the age of 50 and then getting chemo and or radiation for it, you treat the cancer, but you create a whole host of other problems to the other organs. And so, people who've had early onset cancer, they actually have a risk of having a whole bunch of organ problems, 24 different organ problems, congestive heart failure, kidney disease, secondary cancers. And then you think about, especially for women, fertility implications. Having a cancer at a young age, it can really create a huge impact on the ovaries and your ability to bear children.
We were just talking about that this morning with my wish kid. She had a secondary cancer from her first treatment. So you can see how this kind of snowballs into other things. What can we do to help out survivors of early onset cancer?
I think what we're doing today is the first step, which is awareness, because young people need to realize that they are not immune from cancer. In fact, we're seeing a significant increase. They need to realize the impact that it has, the emotional impact, the social impact, how their dating life, how their career, how their emotional, mental health is affected, and we need to create a sense of community for them. So I think that's what we can do as community members. In the scientific community, what we're hoping to do is to start to collect data using electronic health records and using, your urine samples, your blood samples, what have you, to try to understand what are these exposures that our kids and adolescents are having that is then resulting in more cancer than ever before, so that we can hopefully modify it.
You said 50 and under. What about 30 and under? We're seeing increased levels there too?
That's absolutely right. Yeah.
Wow.
Yeah, it's a bit of an arbitrary cutoff, what you call early onset, but really it's changed. The demographic of who gets cancer today is very different than it was 50 years ago.
Very scary. All right, Dr. Kohli, thanks for coming in.